Good morning to the Facebook audience. Good morning, everybody. My name is Kiana Towns Williams. I serve here in the Office of Public Health here at the City of Flint. I'll talk a little bit more about that later. I do want to begin by, as is customary for the show, opening with a prayer. So if we could all just ready our hearts and minds for a prayer. Dear God, I wanted to say thank you. Thank you, God, for this day, for us to be here present to do your will. God, I just ask you that you share love with those folks in our community who have suffered loss, those who are currently going through bereavement. Lord, I understand that we have so many people in our community whose hearts are heavy, and I just want to ask that you be with them and help them to lift that burden so that joy may come to their hearts and to their lives. God, I want to say, if you could please be with our guests today, the ones who are going to share with our audience information that is beneficial to us all, if you could help them to deliver the information that is needed for our community so that we may be like minded and grow. God, I want you to please open up the hearts and minds of our listeners, of everyone who is under the sound of my voice, that we might begin to continue to work together as a community. We know that we do all things under your leadership and through you. And so I want to say in advance, thank you for bringing us together to do the work of our community. This and all other prayers we ask in your Son, Jesus' name. Amen. All right. We will go ahead and get started with our guests on the show today. I am really, really excited to be present with you. Just wanted to give a brief introduction again. My name is Kiana Towns Williams. I work here in the Office of Public Health, which is part of the mayor's office. And just a little bit about what the office does. We have a team of navigators who assist residents with all kinds of needs, everything that you may be looking for resources for, our navigators are prepared to help with. So if you are listening and you need help with finding resources, if that looks like housing, that looks like food, that looks like looking for support around mental health, or otherwise, you can give us a call at 810-410-2020, and one of our navigators will be able to assist you with that. We look forward to hearing from you, and whenever you have a need, or if you know someone else who might have a need, if you could please reach out to us, we'd be more than happy to support. I want to go ahead and go to our very first guest, Amanda Trujillo, who is the treasurer for the City of Flint. Amanda, are you there?
Yes, good morning.
Good morning to you. Can you share with the audience the information that you have today about the water meter replacement?
Yes, the City of Flint has been, improving our water infrastructure for a few years now. We began changing the water meters in 2019. We were replacing meters that were installed back in 1998 and 99, and those only had a battery life of 10 years. So we have gone way past their lifespan, so we are replacing those. And we've already replaced about 26,000 meters in different households. So we have the remaining 4,600 left. And that's what we are trying to get those residents to upgrade their meter. These meters allow us to see the reads, see what the meter is doing. Remotely, we can just log into their website and we can see it. Customers will also be able to put an app on their phone called Eye on Water that they'll be able to see their water usage and how it's moving, and it will give you if there's any leaks or anything like that. So there's a lot of benefits to having these meters changed. So like I said, we are in the last stage of it. We're trying to encourage people to change their meters. We are going different areas of the city that have numerous ones that still need to be changed. Currently, we are working in the area bordered on the east by Center Road, on the west side 475, on the south side Hemphill, and on the north side Robert T. Longley. That is the area that we are currently working on, and we want to get those completed in there. We are mailing out letters to let people know that we are changing them, and then we will go to each different sections, and we will just allow the, and then when we get done with that, complete with that one, hopefully you'll invite me again and I can reiterate where we're going to go to next. So if you don't know if you have a new meter or not already, you can give us a call at 810-766-7015 to find out if you do need one. Because if you haven't received your letter, you can always call us and schedule an appointment before you receive that letter.
All right. Thank you, Amanda. Can you repeat that number one more time?
Yes, 810-766-7015.
All right. Just wanted to make sure I have it for myself and for the audience as well. And so you said there are approximately 4,600 meters left to replace in the city?
Correct.
All right. Well, we want to encourage residents to give Amanda's office a call at 810-766-7015 if you are not sure whether your meter has been replaced, or if you know that your meter has not been replaced and you need to go ahead and schedule that. Again, as Amanda mentioned, there will be letters going out to those who need to have the meters replaced. And you are invited to call if you have any questions. Again, the contact number 810-766-7015 as it's showing at the bottom of your screen, and you will have your questions answered there. Amanda, thanks so much for the information this morning. Appreciate you.
You're welcome.
Oh, I just had one other thing. Can you repeat the name of the app?
Oh, it's called Eye on Water, and it's EYEONWATER, and it's all one word.
Eye on Water, and that app is going to allow us to monitor our water. Is that right?
That's
water
correct.
usage.
You'll just need your water bill. It will have your account ID at the bottom, and that's the number that they're going to look for, that they're going to ask for when you're signing up. And then you'll just need an email address, and you'll be good to go.
Wow, technology is amazing, isn't it?
Mm-hmm.
All right. Thank you, Amanda, for that information.
You're welcome.
All right. One more time for those of you who may not have heard, if you have any questions about water meter replacement, you can give the office a call at 810-766-7015, and they'll be able to answer your questions. I'm going to go next to Dr. Verholden for an update. Dr. Verholden, are you there?
I think we're going to have to reconnect.
All right. Well, while we're reconnecting, Dr. Reynolds, I'll go ahead and come to you. Good morning in the morning.
Well, good morning.
How are you?
Good to be in the land of the living and healthy and in a sound mind most of the time, according to my wife.
I agree. All right. What updates do you have for us today?
Well, today we are still dealing with a peak increase in COVID-19 disease. And the drivers of that are that we have two variants. We have the Delta and we have the Omicron variant. Now, the Delta is more severe, but the Omicron is more infectious, which means if it's twice as infectious, it will still increase the number of people who will need care and increase the risk of complications. So I would not spend a whole lot of time as an individual saying, well, what do I have, the Delta or the Omicron? I would focus on getting vaccinated, getting my booster shot. If you have immunocompromised, get that third shot. I would continue wearing a mask, and a good quality mask. And here's the new change. You wear a N95 mask, or you wear a double surgical mask, or you wear a surgical mask covered by a cloth mask. And the key is you don't put your hand all over the mask. When you take it off at the ear loops, not grabbing it in the center. So that will be a challenge. So vaccination, masking, physical distance, washing your hands, not touching your face, good ventilation. And how do you get that in your house? Well, you don't have a house party with 20 people involved. You don't let folks in your house if they're not masked. If you don't know their vaccination status, because you've already got a problem with household members who are struggling to follow the recommendations anyway. So you don't want to bring unknowns into your house, nor do you want to be in a crowd of people, and it doesn't matter the setting. It could be a restaurant, a bar, a funeral home, a wedding, a church. It doesn't matter. Wear your mask and maintain your physical distancing, because this is most important. And the number of infections is increasing among children. And people will say, well, they don't end up in the hospital. Yes, the numbers of children in the hospital is increasing, because remember I said, the more people get infected, the more there are chances of complications, especially if they have a medical condition that would make things more risky. So we can't get tired. You know, you have heard earlier this summer, people were saying things like, oh, we're over the hump and we're coming to an end and we're victorious. Look, this is a virus. The virus wants to live. It doesn't care what your attitude is. If you are a human, and I might add a deer or a tiger in a zoo, because yes, they have found it in deer and animals in the zoo, you are a host. In other words, it wants to get into you. Years ago, we used to sing a song or hear a song about the boll weevil destroying the cotton crop. And, you know, the song was, I'm looking for a home. Well, the virus is always looking for a home. And I hate to get country on you, but my people are from Georgia too. So keep those things in mind. And then I will repeat the wisdom that our grandparents and our parents gave us. And that is, just because you see your friends jump off the bridge doesn't mean you're supposed to jump off the bridge too. Or as one of our chief health executives for the state of Michigan would say, just because you can do something, like go out, hang out in a crowd without a mask, does not mean you should do that. We are trying to protect our families, our neighbors, our communities, the people we work with, and yes, we're even trying to protect the people we don't feel too good about.
All right. Thank you so much for that, Dr. Reynolds. I did want to go ahead and circle back to your recommendations on the masks, because we know that those have changed a little bit based on the information that's come out from the CDC. And there are a lot of different reports that are coming out through media outlets. Can you repeat those recommendations on the kinds of masks that we should be wearing and how we should remove the mask?
Oh, yes. All masks should be removed by the ear loops first. So you reach behind your ear, latch onto the loop, take it off one ear, hold it with that hand, then do the other side. Behind your ear, latch the loops and take it off and deposit it in the trash. You got that? Most masks are only made for one-time use. Okay, so if you go into a grocery store and you're in there for an hour and a half, I would discard that mask. Now, what are the best masks? Now it's time to move up to the N as in Nancy, 95 mask that has a higher filtration rate. Some have a loop two loops that you put over your head. So it comes around under your ear and over your ear, so you have a secure fit. Now, everybody can't get that N95 mask. There are other high filtration masks that do have ear loops, and you put them on like the regular mask. So that's a possibility too. And if you have the regular surgical mask, the recommendation is now put on 2 masks at once. Okay? And if you have a cloth mask, you should always wear a surgical mask under that cloth mask. And the take-home message is that you do not touch the outside of the mask, the part that is covering your face, because it can have the virus on it. So when you change your masks or take off your masks, wash your hands.
All right, that is poignant and such great information for us to have.
May I add one more thing?
Go ahead.
I neglected to mention that we've heard a lot about the pill that you can take to treat COVID. Yes, you can, but it's not in broad supply. It must be prescribed by a physician, and many times you don't have the time to track down a physician, get the prescription, and get to a pharmacy where you can get it filled. So vaccination is still the key to preventing the complications of COVID infection. I'll repeat myself. Vaccination is still the foundation of preventing the complications of infection by COVID.
All right. Thank you for that information, Dr. Reynolds. Again, always poignant, always necessary information. We appreciate you for sharing with us today. All right. We will go ahead in just a moment to go to Dr. Verholden for an update from her. But I did want to just add a note, as Dr. Reynolds was mentioning, if there are any folks who are out there who are still looking to get vaccinated, if you visit the Genesee County Health Department website, there are a number of locations there where you might be able to go ahead and get vaccinated. So please go ahead and check out the website and find out where you might be able to get vaccinated. Just also a quick reminder again of the number, the contact number, if you need to have your meter replaced, you would go to 810-766-7015, and they'll be able to answer your questions about meter replacement. If you have any issues, if you are looking for any resources and you need support, you can contact the City of Flint's Office of Public Health at 810-410-2020. All right. Dr. Verholden, are you there with us?
I'm here, Kiana. Thank you for calling me back in. My phone dropped. Sorry about that.
Oh, no worries. Thank you for being present with us today. Please go ahead and share your updates.
Yeah, great. So I want to thank my great partner in this fight, in this pandemic, Dr. Reynolds, for just laying down, I think, the best, solid foundation. I often joke with Dr. Reynolds. Sometimes I feel like a broken record because we keep saying the same thing. And I just remind people the very same strategies that we have been using throughout this pandemic are still the same strategies that work. People have asked me about, where are we in the community? I put the link up on the Facebook feed to the most current, report that we produce every week that gives everybody the numbers. Once a month, we break them down by municipality within Genesee County. Flint is sort of right in the middle right now, but our numbers are at an all-time high. And it points to what Dr. Reynolds was telling us. We've got 2 different strains of COVID happening at the same time. I feel like people have been overly worried about which strain of COVID do I have. And I will just tell people, it really won't matter what strain you have or what strains are out in the community. The same strategies will still work. The problem that we have right now is we've got 2 different strains happening at the same time. One that is highly infectious and one that causes more severe symptoms. It's like the worst case scenario that you would want for a virus that spreads through droplets and through the air. So this idea around what can I do to protect myself, the mask still works. The only key is, because this new variant, Omicron, I call it the sticky variant. It takes so little of it for people to get infected. That's why during that Christmas holiday and that holiday season, we saw so many cases, because people continued to get together. They had their Christmas celebrations or other holiday celebrations, and then a lot of people got infected. The key now with the mask is you need a mask that's better fitted and that has better filtration. Why? Because you need to grab those particles and stop them before they get in your nose, in your mouth, or in your eyes, because this virus replicates a lot easier and it takes so little exposure for somebody to actually become infected. I want to also give a cautionary tale to people about these milder symptoms. It is true that it looks like Omicron has much milder symptoms than does Delta. But because we have so many more infections, we're not really seeing the decrease in hospitalized cases or cases who are not doing so well. So it really is important that people stick to the protocols. I'm reminding people that this virus, SARS-CoV-2, the virus that causes the disease COVID-19, is now endemic. It's now just with us. So these strategies are going to be the strategies that we're really going to have to use for the long term. We're figuring out now what it will look like to live with this. And what that means is when we are in these periods of high transmission, people just have to be more vigilant. They have to have smaller events, do things outdoors when possible. Make sure that you have both a well-fitting mask and a mask that has better filtration. So if you've been using just a regular surgical mask, you will probably need to layer that mask. If you've been wearing a cloth mask, you will need to put your surgical mask on underneath of your cloth mask. And please do honor what Dr. Reynolds was saying. Make sure that you take on and off that mask properly, because you could actually infect yourself with droplets on the front of your mask if you grab it by the front. You grab it by the front and you rub your eyes, you've infected yourself. I remind people that COVID comes into the body through the nose, through the mouth, and through the eyes. And to all my sisters out here, I know we love our long, luscious lashes, but I'm warning you, these falsy lashes right now, I call them COVID catchers. Anything that's going to draw something to your eyes or your nose or your mouth is not good at this time and in this season. So I'm going to ask all my sisters to set the falsies aside until we get out of this surge, and we'll leave our COVID catchers alone for right now. I do think, though, it's important to note that when you look at the national trends, we are sort of on par with that. But earlier in the pandemic, when we had a curfew, when we had, even when the state didn't have a mask mandate and we had a mask mandate locally, our numbers were much better. So I'm just asking everybody to consider it's not just about you, it's about everybody in our community, especially those who are more vulnerable, those who already had health conditions, those who aren't vaccine eligible. We have a lot of people who, because of existing conditions, they're going through cancer treatment, they're at high risk for a bad outcome from COVID or from severe illness, but they aren't vaccine eligible. So I think we owe it to all of them to do what we can to keep all of us safe. And I just encourage people, don't see it as a burden. Just see it as the season that we're in right now and what we've got to do, and the extent to which we can do it reliably and consistently will help us emerge out of this better and stronger and know how to deal with future surges that are likely on the horizon later in the year.
Very good. Thank you, Dr. Verholden. Now you just kind of blew my head a little bit, and I wanted to circle back to the lashes because I think it's important to help our community stay safe. You said that we might want to set those falsies aside for the time being. Tell us again why.
Yeah, because I call them the COVID catchers. If you've ever noticed, you put your frosty lashes on, they look great. Boy, do they make our eyes pop and our faces pop. They also serve as sunblockers, right? I notice if I have my lashes done, I don't need my sunglasses. But that's because those long lashes that are coming out, the adhesive that we use to put them on, they also attract dust and particles. all of my sisters know when you have those lashes on, if you have them on for more than a day, you'll notice they kind of get a little dusty. They're capturing things that are in the air and almost serving like a magnet to draw things to your eyes. It's not a smart idea to have anything that's going to increase your potential exposure right now. And lashes absolutely do that. So the COVID catchers or the eyelashes, we need to set them to the side right now. And because I also realized too, because people are masked, I did notice a lot more women, and I've been doing some different conversations with women, are saying, well, this is my way to at least have some kind of expression or do something. I'm tired of being hidden behind a mask, et cetera, et cetera. But I'm just warning people, those false eyelashes are not our friend right now. They literally are drawing things in to your eyes, which is a channel through which this virus can get in your body. So let's just leave those to the side for right now. And I always tell people, let your enthusiasm show. You notice we've taken pictures with masks, and you can actually tell when somebody is smiling now, even though you can't see their mouth. You can see it when you smile, your eyes kind of brighten up and there's a different kind of inviting look that you have. We're going to have to find other ways to let our beauty shine through. But yes, I'm asking everyone, set the falsies to the side for now.
That is really good information. It's not something I had considered before, but it certainly makes sense. So thank you so much for that. Thank you, Dr. Verholden, for always coming through with the positive information, the relevant information to keep us safe.
Yeah, and it's practical because I understand. You know, people talk about this thing called COVID fatigue, right? And I think we've moved way beyond that. Like most of us are truly just over COVID. The problem is COVID is not over us. The virus has no emotion about any of this. It has one goal, which is to survive. And how a virus survives is it goes from person to person. And then they're tricky. They evolve too. The same way human beings evolve, they evolve too. And so the virus is evolving. And these mutations that occur when it goes from person to person, that's how all viruses operate. That is not something that's new or unique to COVID. Because this is a new virus in the human population, however, we're learning how to adapt to those changes and what that means as far as our mitigation strategy.
Indeed.
And so those very basic things still work. The vaccine still works. It's not perfect. And people always say, well, the vaccine won't stop me from getting infected. And that is true. It will reduce the likelihood that you'll become infected, but it doesn't take away the opportunity or the potential that one may become infected. What it is very good at, however, is in reducing severe symptoms and reducing the risk that you will end up in the hospital or that you will die from this virus. And to me, that's plenty sufficient.
I agree with you completely, Dr. Verholden.
Yeah.
I want to say thank you again. I'm sorry. Go ahead.
Yeah. No, if not you, then protect your loved ones, right? Because the other thing that a lot of people don't realize is when you have COVID that spreads to your household, and I had to deal with the same thing, it almost went like dominoes. So the person who wasn't infected was taking care of the people and provided support for the people who were. So just doing everything that people can do during this season to keep themselves healthy. That includes keeping up with all your primary healthcare visits. Please continue with your primary prevention screening. You know, women, continue to get your mammogram. If you're over 45 and you have any risk, remember to continue to get your colonoscopy. Remember to support your loved ones and staying current on their medications and that they have them. You know, we want to keep our eye on the ball of COVID, but we still have to deal with every other health condition that predated COVID that are still happening in our community.
Thank you again, Dr. Verholden, for your time this week. I appreciate you so much. We just have a few moments left. And so I want to say thank you to the WFLT audience. Thank you to the Facebook audience. I want to say thank you to Mayor Neeley for allowing me the opportunity to guest host the show today. It is really great to work under individuals who value the input of women. All right. For everybody, please stay healthy. Please remember to wash your hands. Please remember to take the advice of the doctors and taking care of yourselves, if not for you, but for your family. All of you, please take care. It means so much to us that you stay healthy.